In this video, we're going to be talking about some of the differences as well as similarities between Crohn's disease and ulcerative colitis. So if you've recently been diagnosed with either Crohn's or ulcerative colitis, or if you are considering you might have inflammatory bowel disease, of which Crohn's and ulcerative colitis are the top two types of inflammatory bowel disease, make sure you stay tuned for this whole video because outside of talking about the differences and similarities, I'm going to be giving you one important tip when it comes to treatment for these conditions. So stay tuned for that. Now, my name is Dr. Sean Golden, and I run goldenhealthmethod.com, which is a website dedicated to giving you natural, research-based solutions for chronic health conditions. Now, again, in this video, we're going to be focusing on Crohn's and ulcerative colitis. And there are some differences, and there's also a lot of similarities between the two. Now, the first similarity is that they're both considered autoimmune conditions, and that involves chronic inflammation. So what that means is that the body is actually attacking itself. The immune system isn't functioning like it should, and what happens is our immune system, this should just be targeting pathogens like bacteria and viruses and fungus. It actually starts attacking ourselves. And there's a lot of different reasons how this can start. Some of it has to do with environmental reasons, like diet, lifestyle, stuff like that. And some of it has to do with genetics. There is an interplay. It isn't just a genetic condition because all the people with the same types of genetics do not develop Crohn's or UC. However, genetics is a component of it. But however it gets set up, the result is chronic inflammation, but the chronic inflammation is specifically coming from the immune system attacking itself. So when you want to get to the root of the condition, that's when you want to start targeting the immune system. So this is why general anti-inflammatory treatments are not typically very effective for Crohn's and ulcerative colitis because it's only targeting inflammation and not targeting the immune system that is not functioning properly, which is what's causing the inflammation. Now, I don't want you to think in terms of an overactive immune system. If you have Crohn's or ulcerative colitis, I don't want you to think that your immune system is just too active. That's actually not the right way to think about it. The better way to think about it is that the immune system is dysregulated. Because the immune system isn't just one thing. There's so many different components to the immune system. And what they found for both Crohn's and ulcerative colitis in their research is that some components of the immune system are upregulated. But then there's some components that are downregulated. For example, there are T regulatory cells, which help the body protect against fighting itself and attacking itself. And if that type of T cell is down-regulated, which it tends to be in Crohn's and ulcerative colitis, then that's going to set it up for higher chances of chronic inflammation, higher chances of the immune system attacking itself. So again, dysregulation, not overactive immune system. In fact, one research study, and this is just one out of a bunch that I could have pulled, said that steroids, which are anti-inflammatory steroids. These steroids shut down the immune system. They lower the immune response. These steroids are similar to cortisone or cortisol, which is our body's natural anti-inflammatory and stress hormone. Now, steroids may be temporarily effective for IBD conditions such as Crohn's and ulcerative colitis, but subsequently may make patients steroid dependent, resulting in long-term treatment and increased risk of adverse drug reactions. Now, this is one of the big tips I want to point out to you guys today. If you've recently been diagnosed, or if you're on steroids already, or if you're planning on going on steroids, if that's what your doctor is telling you, I'm not saying steroids are not necessary sometimes or not a good option. However, if you start to rely on steroids, if they start to be overused, which unfortunately, frequently that is the case, all you're doing is you're shutting down the immune system. You're shutting down the inflammation. The cortisone, the steroid, is a stress hormone. That's what it is. Our body releases cortisol during stress. And that cortisone shuts down inflammation because our body isn't worried about fighting things when we're stressed out. When we're running away from a lion, we don't need to be repairing our colon. So those processes get shut down. That inflammation gets shut down. However, suppressing the immune system with steroids, for example, decreases inflammation temporarily, but it also decreases any healing that can occur. This is actually why chronic stress is linked to ulcers, for example, because ulcers in our stomach or small intestine, that lining, that tissue lining needs to get replaced very frequently. The tissue lining in the stomach gets replaced every 7 days, for example. So if you are chronically stressed, and therefore not only chronically shutting down inflammation, but chronically shutting down healing and regeneration, then that stomach lining can't repair, and you're more likely to get an ulcer. Now, yes, in that particular case, bacteria can be involved in that ulcer development, but it's not like bacteria are the only contributing factor. Stress is a major contributor, which we've known for decades, and that's the process of how that happens. It's the same in the colon. When you overuse steroids, when you try to just shut down that immune system, you will feel relief, and that'll feel great, and you'll love it. But it's false hope in a sense, because eventually that steroid's going to wear off, or you're going to just become treatment resistant or steroid resistant, and then you can have a huge bounce back where your symptoms can just come raging back because you've shut down inflammation for so long, but you've also been shutting down healing and repair. So I want you to keep this in mind if your doctor or anyone is trying to push frequent usage of steroids for Crohn's or ulcerative colitis. So that's a very important point. Just want to bring that up in this video. So if you've recently been diagnosed, you know that up front. Now, a difference between Crohn's and ulcerative colitis is that Crohn's has something called skip lesions. Now, what skip lesions are is when you look at the colon, if you go into a colonoscopy and they actually look at how the colon physically looks, you will see areas of damage in the colon followed by healthy tissue. And then again, there'll be areas of damage followed by healthy tissue. Those are called skip lesions, and that is a characteristic only of Crohn's. So if you have skip lesions, you have Crohn's, like 99+% of the time. Now, if you have ulcerative colitis and they do a colonoscopy, they're not going to see that. What they're going to see is continuous damage. It's not going to have healthy tissue in between. You're going to have ulcers in the colon. That's why it's called ulcerative colitis. And those ulcers are going to be pretty continuous. They're not going to skip like that. Now, one last difference between Crohn's and ulcerative colitis is that Crohn's disease involves all the layers of the GI tract, meaning the inner layer through the outer layer, as well as involving the entire gastrointestinal tract, all the way from your mouth to your anus. So it can really involve the whole thing. That's important to know because Crohn's can have symptoms that you might not think are related to Crohn's, because if you think Crohn's only involves the colon, then you might be confused why you're getting mouth sores, for example, because Crohn's isn't just a colon disease or a colon condition. It's an entire gastrointestinal condition. The majority of it is usually in the colon, and sometimes that's the only place you really have symptoms at. But other times you might have symptoms at other places. You might have them in your small intestine, in your stomach, in your esophagus, or in your mouth, throat, lips, stuff like that. So it really can involve the entire path. Now that's different from ulcerative colitis. Ulcerative colitis is not all the layers of the colon. It's only the innermost layer that gets damaged. So that's one key difference. And the other thing is that with ulcerative colitis, it only involves the colon. So it doesn't, you typically don't get those mouth sores. You don't get other areas. You don't get small intestine, stuff like that. It's only located in the colon. And usually, more often than not, the distal or the end part of the colon is most common. So those are some major similarities and some major differences between Crohn's and ulcerative colitis. Stay tuned for my next video, which I will link in the description below, where I go over different symptoms between Crohn's and ulcerative colitis. So make sure you stay tuned for that one, and I'll see you next time. Hey, Dr. Sean here again. I just want to jump in at the end of this video to let you know that I created a free mini course for those of you who have inflammatory bowel disease, Crohn's, and ulcerative colitis. It's called IBD Get Your Fats Right, and what it is it's really a comprehensive mini course trying to make it as simple as possible on the importance of choosing certain fats to consume on a daily basis compared to others. Because most people don't understand or underestimate the role that the types of fats that you consume and possibly the quantity of fats that you consume can play a major role in symptom progression and the ability to possibly get into remission if you're suffering with inflammatory bowel disease. This is something that's critically important. It's why I created a free mini course around it. Trust me, it goes way farther than just eat good fats and avoid bad fats. You're really gonna love it. It's really gonna help you understand what you need to do in order to gain freedom potentially from your chronic health condition. So I urge you to just check it out. It's completely free. There is gonna be a link in the description below. So just go there and check it out. I hope it serves you, and I'm excited to see you again. Take care.